Welcome back to my channel. Can diabetes cause high blood pressure? Diabetes and high blood pressure are two conditions that often coexist and can significantly impact each other. Understanding the relationship between these two conditions is crucial for managing both effectively. This post will explore how diabetes can lead to high blood pressure, the risks associated with this combination, and strategies for effective management. The connection between diabetes and high blood pressure. Shared risk factors. Both diabetes and high blood pressure share common risk factors, such as obesity, an unhealthy diet, and physical inactivity. These lifestyle factors can contribute to the development of insulin resistance, which is often seen in type 2 diabetes, and can also increase blood pressure by causing changes in the body that make blood vessels more rigid and less elastic. The role of insulin resistance. Insulin resistance, a hallmark of type 2 diabetes, can contribute to high blood pressure in several ways. Insulin resistance can lead to higher levels of insulin in the blood, which may cause the kidneys to retain more sodium and water, leading to increased blood volume and, consequently, higher blood pressure. Additionally, insulin resistance can affect the balance of various hormones that control blood pressure and can impair the ability of blood vessels to dilate. Effects of high blood sugar. High blood sugar levels, which characterize diabetes, can damage blood vessels over time, making them stiffer and less able to accommodate blood flow smoothly. This damage can also affect the tiny blood vessels that help regulate blood pressure in the body. Health risks of high blood pressure in diabetics. The coexistence of diabetes and high blood pressure can significantly increase the risk of developing other health complications. These include heart disease and stroke. High blood pressure and diabetes are major risk factors for cardiovascular disease. Together, they can greatly increase the risk of heart attacks and strokes. Both conditions are leading causes of kidney disease, which can lead to kidney failure if not properly managed. High blood pressure can exacerbate the risk of vision loss in diabetic individuals by damaging the blood vessels in the retina. Effective management of both diabetes and high blood pressure is key to reducing the risk of complications. Here are some strategies. Adopting a heart-healthy diet that includes lots of fruits, vegetables, whole grains, and lean proteins can help. Reducing sodium intake is particularly important for lowering blood pressure. Regular physical activity can help manage both blood sugar levels and blood pressure. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week. Losing weight can improve insulin sensitivity, lower blood pressure, and reduce the risk of cardiovascular disease. Many individuals with diabetes and high blood pressure may require medication to control their blood pressure effectively. Keeping blood sugar levels within a target range is crucial and might require medications or insulin therapy. Regular monitoring of both blood pressure and blood sugar levels is essential. It helps in adjusting treatment plans promptly and effectively. While diabetes does not directly cause high blood pressure, the two conditions are closely linked and often coexist due to shared risk factors and the effects of diabetes on the body. Managing both conditions through lifestyle changes, medication, and regular monitoring is crucial to reduce the risk of serious complications. By understanding the connection between diabetes and high blood pressure, individuals can take proactive steps towards maintaining their health and preventing further complications. If you have diabetes or high blood pressure, consult with your healthcare provider to create a management plan that works best for you. If you enjoyed watching this video, then like and subscribe to my channel